Good morning. So it's Saturday and I am still resting my eye, as you can tell here. And it's cold here. It's windy. Yeah, so hence the sweater. And so I don't feel so bad staying inside and laying in my bed. I was just laying in my bed. But I was just going to upload this video, so I took this footage on Friday. So it's Flyback Friday, it's called, at Dr. Gulani's office, where all the patients then come in on Friday. He checks your eye, and then people fly back. Obviously this time, so this is my 4th time here. Usually I would be flying back, but I am staying in Jacksonville. I'll be at the RV park till the 4th. Yeah, that's the day I'll leave here. And then I'll get on to other adventures. But I just kind of wanted to wrap up my eye surgery adventure. And I did. Yes, I did. One more interview with Dr. Gulani just to kind of wrap everything up. And I waited around for him for like 2 hours till he was done with seeing the rest of the patients. And I just laid in a room and rested my eye. I don't know why I do that every time I say I'm resting my eye. Anyway, so there's a final interview with him here. And also, Dr. Gulani takes video of, and it's for like training purposes for other doctors and everything, the actual surgery of my eye. So I got that video. So, and then when he saw me, when I went to go in to see him on Friday, which was yesterday, he looks at your eye just to see how it's doing. Mine's doing amazing. And then he takes a picture and he puts it up on the screen. And my eye looks so beautiful. I'm like, can I take a picture of that? And so I took a picture, so you'll see that. And then they gave me the video of him doing, actually in surgery, and of me like laying there, and also like specifically of my eye and what it looks like. He showed the wrinkles in my eye. And I didn't know I had wrinkles in my eye. I know I have wrinkles around my eyes, but not in my eye. And so it's a close-up of that. To me, it's very interesting. And yeah, so I'm just kind of wrapping this up, my eye adventure. And after I'm done here, I plan on going, I think I'm going to go to St. Augustine. I heard it's so beautiful. So I think I might head there, because then I'll be heading to Minnesota on the 11th. I thought it was the 9th, but it's the 11th. So that'll be another adventure. So let's just keep rolling along. But I just want to wrap this up, and I'm going to go back and rest my eye. People probably think, I kind of keep this eye closed like what I'm out. They probably think I'm winking at them. Oh well. Okay, so I'm going to play this, and I'm just going to say it now, because I'll just let the interview end the video here. So go out and make an adventure, no matter how big, no matter how big or how small. I'm not even on anything right now. And don't forget your magic. And don't forget your meds too. I think that's hilarious. Okay, don't forget your magic, and I'll see you in the next one. So here you go. My eye surgery and Dr. Gulani. okay, I am done with my surgery. I could see. And it's called Flyback Friday. This is my 4th Flyback Friday.
Yes.
And the difference with this one, and why I'm giving the whole journey again, instead of pingulicula, I'm here for eye vision correction surgery. And now I can drive with 2 eyes instead of 1 across the rest of the country.
On the right street, yeah.
Yes. And there were more people. I said you have to get a wider lens for Flyback Friday, because how many people were there today?
I think about 39, maybe. 39, yes.
And you know what's interesting too for me, and what I kind of want to like round this up, because you actually spend the whole week with everyone.
Yes.
Like no other
Hours.
In hours.
Days.
Yes, they come in, usually fly in like Sunday night or whenever they fly in, but then you see everybody Monday. So kind of, can you tell like the pattern and like what they do for the week, like how you work it?
Sure. So as usual, another video from Tracey.
Yes.
Again, I'm between a working day, so this is as usual, impromptu, straight from the heart. Nobody has any makeup here. Everybody's just boom, boom. And Tracey actually had surgery yesterday, so it's less than 24 hours she's here, and I love my patients, and she in particular has taken this opportunity, catches me down, and let's answer questions for her. And I love it because it has to be real for every patient. Your eyes are so precious. So the answer to that question, Tracey, is I always tell people I'm so simple. It's a very simple thing. If you respect somebody and you think highly of them, you dress up, you clean your home, and you're waiting for them on time. Same thing. My patients, I love them. And so whenever they come in, we are always on time. My amazing staff and me, nobody waits, as you've seen.
Right.
Sometimes I get this funny question from patients. They're coming from far, far away. Then they come like, okay, this guy's the most famous eye surgeon in the world. They expect to be a crowded room with people waiting. It's shocking sometimes. They walk, it's like nobody. So they're like second guessing, like, is this guy real?
That was my first time I walked in. Like, I thought he was famous. Where are all these people?
So that's the price I pay, but it's okay because it's all genuine. There's no show. And yes, Tracey, so each one arrives alone, as you know.
Yep.
I mean, with their family,
Right,
a loved
yes.
one, but we don't have a waiting room. It's a lobby. I love the fact that they're on time, and then I spend hours with all of you. And then on Friday, suddenly you see 25, 30 people flying from all over the world. And I have to give credit to my staff, and it is truly my desire that every patient be treated like on time, perfect. And then Friday is not just flyback Friday, it's just to show the camaraderie.
Right.
All of you are tied by a string of vision. All of you were left visually affected by cookie cutter surgeries. You're another example of that. And how I expect patients to be more demanding and more investigating about, doctor, these are my eyes. Can you please tailor my surgery to me?
Well, and I have to tell you, so, you know, when I met Janet's back there, I had already talked to her and her husband out there. You know, I'm like, oh, what you have to, you know.
Janet from Colorado, yes.
Yep. And then the guy and his son from Florida still.
Yes, and the Texas guy.
Yep.
Yes,
and then Kent came a little late. He missed the picture, and I was talking to him, and he was explaining. And I do have to tell you, like, we are like, oh my gosh, Dr. Gulani, can you believe it? And Kent even said, and again, Dr. Gulani called last night at 7:30. You guys were here late last night. And you were still in the office, and you call all the patients. Again, what doctor is that? Especially after you had done surgery all day. And Kent told me he told you last night, it's more than eye surgery. What you do is also a ministry.
Wow. Again, I've heard a lot of things patients call me, but that's again a new one among thousands of patients. I know he, poor thing, had 9 surgeries per eye in Texas.
Yeah.
Was left with nothing, and I think in 4 minutes, Jackie, we lifted off his car. The guy was crying.
Mm-hmm.
This is a very amazing guy.
He said it felt like there was a stick in his eye all the time, and he had gone to specialist and everything else, and he was sitting there like feeling no patch, no nothing, just feeling good.
All of you.
So.
I mean, your story too, Tracey, now that you are here full time for different reasons.
Yeah.
Is we did the pinguicular surgery on each side of her eye to make it sparkling white from the red it was. And then yesterday we fixed her previous LASIK that she had in Minnesota. And more important in her LASIK, she hadn't even complained about this. She just complained about bad vision.
Yeah.
Is we had already detected scars and wrinkles. We call it micro and macro striae or wrinkles in the LASIK flap. And that's again because the LASIK was done in a cookie cutter fashion. And that too we straightened out yesterday while doing laser plastic. And within few minutes you were already.
And I'm going to show the video she showed me, because Dr. Gulani, not only, I mean, what doctor records you doing surgery and then lets other people watch or shows it to other people? And she was just showing me the picture, because I saw the picture today. So I came in, we all come in and see you, and you check our eyes again and stuff. And then there's a picture of my eye up on the thing, and I'm like, wow, that's beautiful. It's all smooth. So I'm like, can I take a picture of my eye? So I took a picture of it, and I didn't even realize till she showed me the video what it looked like beforehand.
Yeah. And all this, Tracey, as you know, I'm impatient for my colleagues to catch up.
I know.
And
So
it's not about bravado, it's more about my desire. I mean, not only do I love my patients, and I feel this is a gift I have of how I'm fixing all of you when everybody says no, that too in minutes, plus you'll look like this on day one, nobody knows you'll have surgery, and you're flying, everybody's flying.
Right.
And to me, teaching is very important. More than teaching, it's like I'm wanting to inspire, encourage my colleagues to stop being cookie cutter surgeries, take it to the next level. So we record our surgeries. If you see, it's a glass, it's literally like a museum or a viewing area for everybody to see. Patients, their families, their visiting surgeons, sometimes doctors accompany their patients who had complications. I mean, and plus these are not planned or stage surgeries. Like you don't take a normal person and do a simple LASIK and go, here's a viewing window, everybody watch. You know the expectation.
Yeah, exactly.
Each one of you are very complex, but I feel that transparency that I've had for 3 decades where I share with patients, you guys are sharing on YouTube and stuff, and no incentive. None of my patients have any incentive.
Well, I do have incentive because, like you said, I got my confidence back, and I want to share that with everybody because I want people to know there is, because Ken said too, I was not satisfied with that answer that those people were giving him, because they wanted to give him just like some lens, and he goes, but the problem's still there. And he goes, and you kept digging, and that's what I did with you also. It's like, come on, pinguliculas have been around forever. There has to be some, and here's the thing for me too, it wasn't just getting rid of the pingulicula, it was what it cosmetically looked like.
Yes.
Because, I've modeled in the past, I've been on TV.
Yes.
And for me, that's my confidence.
Correct. One more thing, Tracey, because you have documented your journey, especially pinguicula and all. Remember, I've mentioned the triad, right? Pinguicula, dryness, and vision.
Right.
Most pinguicula patients or pterygium patients also have vision issues, nearsightedness, astigmatism, reading vision, whatever. And they always have inherent dry eye issues. So the laser plastic I did yesterday for you is non-cutting technique, doesn't cause any dryness. So all this is a design. How do you don't damage even your own previous work? How everything you do just takes them further and further towards a phenomenal goal, look good and see good, and free them up. So coming back to your transparency, I'll let y'all take photos. I'll let y'all have fun with me. It's always fun. People make me do, pictures with their kids to inspire. I love it. But to let y'all watch these surgeries where even I don't know what's going to happen next. It's just that I've planned for y'all and I'm very confident about it, but I'm human.
Right.
But I let everybody watch. There's not only a viewing window, the entire thing is glass. My entire surgical suite is glass.
Right, it is.
So it's like an amphitheater for surgeons to watch inside and outside. Plus I'm recording my hand movements on a bigger screen, as you see. So I want surgeons to learn everything that I do and then do it. You don't need to travel to me. Just as patients, if you're listening, encourage your doctors. And if your doctors, you're welcome. Anything you need from me to do these things. It works. And not only it works, think about it, this is not an advertising. I'm sitting here in between a busy working day. Like I said, none of this is scripted. My amazing patient sits me down and we're talking with our heart, and I want every patient to demand the best vision, the best surgery, and ask the question, is it designed to me? Am I getting one among the 3 or 4 things on your cookie cutter menu, or are you a master chef? Are you planning everything for me? You deserve it as patients.
Well, and then not only did you start early yesterday, you work late last night, plus then you call your patients to check in, and then you show up like this, like just well put together and so happy. We even said, whatever you're having, we want, because whatever that energy, and we were saying, it's the passion, you can tell, that fuels you. And it's not, I think I told you when I went to that doctor back in Minnesota, because I was talking about my pain, he seriously was like, Tracey, I was the first one. I was at 8:00 a.m. I was the first patient, and he was already like this. And he had a line. Seriously, when I walked out, I walked past a whole line of people sitting right next to each other, just waiting to get in for their 5 minutes to see them. And so, what you have, and I think, we said, sometimes people can't believe it. They say, is he real? He's real. And then we're all sitting in the waiting room when afterwards we were all talking about after a surgery, and we were like, we tell everybody, yes. And I told you, people have seen my videos on my pings and have written me from Germany, have written me from Italy, have written me from UK. Like, if this is, and they fly over, and then they find out that you are exactly what you present yourself to be.
I mean, the biggest lesson I teach, I've been giving inspiration talks now at university. I say, be you.
Mm-hmm.
Don't try to be anybody else. And people love you the way you are. So you don't have to wear a suit. This is just, I like it. Right. Because to me, if my shoe doesn't match, my belt doesn't match my watch, I'm uncomfortable.
Right.
So everything has to match, everything has to. So that's just me. I mean, please, there's not a necessity at all. And fashion is my other passion. So just find what you like, and then you don't have to work. I mean, I love my staff. They're like family here.
Yes.
My patients, I mean, there's no line, there's no division here.
Right.
My Facebook is my patient's writing.
Right.
Everybody has access, and I feel that's how it should be. Why create artificial webs and then try to untangle yourself? Just go, and the flow is already decided. But be the best. Be the best in these opportunities, Tracey. And again, remember, no one's waiting. We're doing this in the middle of a busy day.
Right.
No one's waiting. We're having fun. Now I'll sit with my staff and have ice cream.
Well, and that's what I wanted to say too, that I want to recognize also. You treat your staff with the utmost respect.
They're amazing.
And that's it. Do you know what I mean? Like, you are always very cordial, and, you're always like buying lunch for everybody, and but I've never seen, even under stressful time, because yesterday was a very busy day, but you were like having fun. It's like a well-oiled machine. Do you know what I mean?
We did a boomerang, no?
Yes, and he did a boomerang.
I mean, the attorney from California, he's crying, and then today he came up with a great statement. He wanted to do his wife and him, right? Mm-hmm. They did a YouTube. I mean, it's just, I feel people need to be allowed to release their pains.
Yes.
But you don't just want to be a doctor who gives hope.
Right.
That's half the job.
Right.
You have to perform.
Right.
Because by the time they come to me, but I don't want them to be at that stage of complications. I want them to start right. Like, if you have glasses, don't say I want LASIK. Say, what is the best vision corrective technique for me, doctor?
Right.
That's it. It should be designed to you. There are 40 techniques, remember I keep saying. 40 and unlimited technological applications. Do not fall for advertising. Absolutely don't fall for deals. And you don't want surgery on a Saturday. Please. Because I'm the guy facing all these complications when you'll fly to me. And these are not your fault.
Right.
Just be serious.
Yes.
It's your eyes. Think about it. Do your research. Spend months if you want. Then come over.
I told you there was a woman that responded when I uploaded my first video here. And she said she had 4 or 5 surgeries just this year. Mm-hmm. And she said her vision is worse now than it was. But as a layperson, you're just like trusting that, okay, you need another surgery. Do you know what I mean? That'll fix the problem. Oh, you need another surgery. And you're like, oh my gosh, well, okay, whatever you say. Mm-hmm. And that's the thing, I think, too, like you said, don't fault yourself. You're not the person, you know what I mean? You're trusting.
Absolutely. And even if you see yesterday, Tracey, all these patients who came with various complications from all over the world, I sit down with them first. I tell them I cannot guarantee an outcome because it's like seeing an accident case. Mm-hmm. Every accident case is different. Every bone is broken differently. It's not a disease where the bone breaks in a certain direction where we can predict. So each one who comes to me has had multiple issues, multiple surgeons. My predictability is lower, but the fight is intense, and I'm blessed with the results that they still land at amazing results. That is also important. I'm not a magician. I'm a simple person. I just believe, yes, the skills are there. Yes, the desire is there. Yes, the fight is there. And then, yes, there's a track record. And you must investigate. It's very important.
And
Absolutely.
I think that's it. We need more doctors to have more of a passion to up their level to perform better. And there are, you've had all these innovative things and you're willing to show everybody how to do it, but you can't make people want to be better. Some people, but like you said, then you get the people coming to you. don't use a Groupon for surgery. Don't surgery on Saturday, because then you'll have to come to Dr. Gulani, and I mean, which is amazing that he's here. And that's why I said your kids have to go to eye school, be eye surgeons.
Yes. So again, I won't stop inspiring my colleagues. I mean, that's not going to happen, and I will keep continuing. But my patients, you are my biceps, all of you. When I walk on stage and I'm talking, it's not some graph or statistics that can be fudged.
Right.
Real people on camera who are very intelligent by the time they come to me. So they are intense people. And appreciate all this, Tracey, always, all of you.
Yep, well, because they just want help just like I did. You're the best.
Get some rest.
Yes, I
Day
will.
one surgery.
I gotta go. Rest my